everyone. Welcome and thank you for joining today's webinar, HIPAA in the Cloud. My name is Marcy Polanski and I will be the moderator for this presentation. Our goal is to keep this webinar to as close to 40 minutes as possible. To keep the flow going, we will answer any questions at the end. Please feel free to submit your questions via the questions window throughout the webinar, and we will answer all that we can during the Q&A session. In this webinar, we will cover the following: introductions to our speaker, Chad Kissinger, evolution of the cloud, the benefits and obstacles of cloud hosting for healthcare data, key concerns for working with cloud providers, an overview of OnRamp's HIPAA-compliant hosting solutions, the Health IT Cloud Forecast, and questions and answers. Again, please feel free to submit your questions via the questions window, and we will answer all that we can at the end of the presentation. And now, allow me to introduce our speaker. Chad Kissinger founded OnRamp in 1994. Since founding OnRamp, Chad has driven the growth and business model evolution of the company from a startup ISP to an established provider of data center services. Chad has been instrumental in shaping OnRamp's compliance-related services and is a thought leader on the subject, speaking at organizations around the country about meeting the stringent IT-related requirements associated with HIPAA, PCI, FISMA, FERPA, and SOX. And I would now like to turn the presentation over to Chad.
Thank you, Marcy. I appreciate that. And welcome to OnRamp's webinar. Again, today I'm going to be talking about HIPAA in the cloud, and specifically related to the concerns about ensuring data availability, security, and compliance. OnRamp has, over the past 20 years, really personally witnessed, us at OnRamp have personally witnessed the evolution to the cloud. And more recently, the evolution of the healthcare industry. The healthcare industry, of course, has been one of the laggards in adopting technology and moving towards cloud technology for a variety of reasons. But we've at OnRamp have specialized in it and have a lot to say about it. We, of course, are an enterprise class data center operations company that specializes in deploying computing infrastructure for companies that need high availability and high security computing. And as a consequence, we deal with a lot of healthcare companies and have, over the past several years, begun to deal more in depth with those companies' security requirements related to dealing with HIPAA using our services. Now, cloud computing is a broadly used term, and I like to think of it in kind of as two different types of things and go over the evolution of one of those types of cloud computing. The first type of cloud computing that I think exists out there is the Salesforce type of cloud computing. It's the type of cloud computing where instead of a software developer developing software and sticking it in a package and then selling it to somebody that would then go out and maintain it themselves, the software developer instead builds a website or a web-enabled application that then people then can come across the web and get to and then use. And the functionality they derive from that website is the same functionality that was previously delivered in that shrink-wrap packaged box of software that was previously shipped to the customer. And we're not talking about that type of cloud computing, except to the extent that a lot of those companies that do those types of services, that offer computing functionality using that type of cloud computing, often use our business to do that. So from their perspective, that's the type of, we'll be talking about cloud computing, but not from the perspective of a user that goes out and obtains functionality by getting an account on somebody on the internet. The other type of cloud computing, of course, is the mechanism by which companies take their IT operations, whether it be internet operations or primary IT operations or user desktops or anything, and instead of offering it using equipment that they control and maintain, they shift that out into a third-party provider. And they allow that third-party provider to take over control of that system. And that's the type of cloud computing that we're discussing today, and I would like to initially discuss about the evolution of the cloud on this slide. About 20 years ago when we started OnRamp, most computing, especially in the healthcare industry, was located in-house. Most people didn't have the ability to transfer data at very high speeds. Telecommunications were very slow. When we started, they were at 14.4 kilobits per second, so you couldn't even transmit pictures very well at that point in time across the internet. So people just didn't use the internet, and people didn't use remote computing that often. But as the rapid development of two very important technologies, the first being telecommunications, occurred, we started to see the development of remote workers and the need to have people get access to data from remote places. We also saw, of course, the explosion of the internet and the emergence of the capability of individuals to access their own healthcare data and to interact with healthcare companies and to start manipulating their own protected health information across the internet and doing things like that. And we saw clinics opening up and businesses that ran clinics and remote places with remote locations starting to see that they could centralize computing and offer computing services themselves to those remote clinics through telecommunications. So what you started to see was that these people had a need for reliable communications and reliable availability. They, a lot of times those clinics are open in the middle of the night, and a lot of those times those people that are coming across the internet to get to the protected health information want to do it in the middle of the night. So they have a need for availability, and that drove those companies out into the second box on this slide, which is from in-house to co-location. And they did that because they didn't want to worry about generators and air conditioners and internet connections and all those types of things. And in effect, when they did this, what they were doing is they were really outsourcing everything outside of the computer rack or the computer case, if you will. All the environment around that and the protection that physically existed around the computers were the duty of the third-party provider, the co-location provider that was selling them that co-location. Yet the company themselves, the provider or whoever that owned the computers that was providing the service that used to do it in-house, still had control of their computers. They still were maintaining their computers. They're still updating their computers. They're still backing up their computers and protecting it, and in general providing for the confidentiality, availability, and the integrity of the data on the computers. And then a little bit later, a second development has occurred in technology, and that's the development. Well, it's really a two-part development. One is the development of virtualization, and the second is a more broadly, a longer development, just generally the development of the web enabling of applications. And this is the idea that you can, virtualization being very important in that you can, of course, separate the computing load that exists on a computer from the physical computer that's doing it. And you can do that in such a way where the operating system that's running the applications on that computer have a virtual view of the computer and can be shifted around between physical boxes and back and forth between physical boxes. And of course, we use virtualization for a variety of reasons to get more use out of computers and to do a variety of things. But some of the more interesting things, of course, are it allows us to be able to provide high availability, so provide greater availability and be able to use multiple computers to provide redundant operation of an operating system. It offers us the ability to shift data from one computer to another, which of course means that we can shift it not necessarily inside the same facility, but to different facilities in different places. And that, of course, allows us to do things like affect disaster recovery or even maybe move into a third-party computing infrastructure. And that's really what facilitated the movement across these last two squares, the development of what we call private clouds and then public clouds. Now, healthcare obviously has a great, healthcare and many businesses have had a great problem with moving rapidly from the left to the right on this diagram. And we've seen in other industries predictions that everybody would rapidly move directly from the left all the way to the right to the public cloud. Well, healthcare companies, along with a lot of other companies, have specific requirements that have kind of stopped this from happening. First of all, one of the first big problems that healthcare companies ran into in the evolution of the cloud was in the co-location space. As people started moving their EPHI out into data centers, the question arose about whether data centers were really business associates under HIPAA, whether they were required to sign business associate agreements and whether they were required to participate in the protection of the confidentiality, availability, and integrity of the healthcare data as the covered entities were required to do under the security rule, the privacy rule, and the breach notification rule. Well, in HIPAA, the original HIPAA, there was an exception to the business associate rule that said that if you were merely acting as a conduit to the data, you weren't really touching the data, you weren't really manipulating the data. Your business was one that just was involved with helping move the data along between two places. Then you were merely acting as a conduit for the data, and you weren't really involved in the protection of confidentiality, availability, and integrity. In our industry, the internet, the co-location industry, and to a large extent even the private cloud or the managed hosting industry, it used to be called, has asserted the conduit exception, asserted that, hey, we don't have anything to do with the protection of this data. We're just merely acting in a co-location either as the landlord or in the managed hosting. We're just the IT provider, and our customer really is in charge of that. Well, a few years ago, in 2009, they came out with the HITECH Act and the Stimulus Act, which changed things, and this was really clarified last year, in January of last year, with the omnibus rule being published. The omnibus rule, of course, was the regulatory implementation of the HITECH Act, and they make it very clear in the omnibus rule that people that have persistent access to EPHI or persistent access. So even if they use the example of a storage vendor whose job is to store paper records of a healthcare company, even those people are business associates because of their persistent access to the data. Even if they're not accessing the data on a regular basis, they have the ability to. So they are business associates and have to sign a business associate agreement, and that's caused problems. That's caused resistance from many people in our industry. Many people in our industry are unprepared for dealing with that, and many people in the healthcare industry are now, of course, demanding that they do take care of that, and there's some conflict there, and that has caused some delay in the rapid adoption from going from the left of the in-house into the public cloud. So what we've ended up with is really a different solution than just the public cloud. We've ended up with what we call hybrid computing solution. What we think the healthcare industry is doing now is really deploying what's called hybrid computing. At least we see that in our data center. What hybrid computing is really not the adoption of a particular technology on the previous screen, but really the blending of different technologies in a way that allows an organization to protect their information, yet allows the organization to opportunistically adopt supplementary services that are more appropriate for providing the functionality that they want on a particular, for the marginal computing need or for the next project that they're going to do. We typically see people starting with co-location because that's obviously the natural point of evolution that they begin in. They start in in-house computing and then they move into co-location because they feel comfortable with it. Maybe they existed under the mistaken impression that they didn't need a business associate from their data center before, but they move into our data center. They understand that we're really compliant with HIPAA and understand it, and they adopt co-location. We in co-location are really have a landlord type relationship with the customer. We're in charge of really the physical security and all the environment around the rack, and making sure that only the appropriate people are allowed into the rack. And to the extent that we are involved in the electronic access to the system, we need to make sure that we don't offer logical access to the system to the wrong people that aren't authorized by our customer. So co-location, we're really pretty much acting like landlords, but vigilant landlords that are there 24 hours a day watching and helping and ready to assist. But then people also move into private clouds, obviously. Private clouds being, for us, the way we at OnRamp describe those, are dedicated sets of equipment that are, the physical computers are dedicated to an individual customer, and then they have been made cloudy by the application of VMware or some other virtualization product that helps them enables us to be able to shift their operating systems back and forth. And that, of course, gets us all the advantages of virtualization. We can offer much higher levels of availability. We can much more rapidly start up and stop services. We can replicate snapshots and other types of images off to backup resources, and we can more effectively offer continuous operations across multiple data centers. Now, oftentimes our customers, for a variety of reasons, can't, co-locations and private clouds don't fulfill all of their needs. So we supplement those with what we call cloud delivered services, which are very similar to, I would classify these services very similar to the Salesforce type services in that their computing functionality that now has been is just remotely delivered to the customer. And in this case, instead of it being remotely delivered to a person sitting at a desktop, a lady sitting at a desktop trying to get to her customer data in Salesforce, this is a service that's delivered to a group of servers or a much larger enterprise infrastructure that's located in its customer's co-location or private cloud infrastructure. And these services are like, some examples of them are remote backup services where we would back the data up and take it off site in case there was what we call the Godzilla problem, something destroyed our data center like Godzilla stomped on it. Or something like that. We have remote storage services, remote intrusion detection services, and a wide variety of security services that aren't really co-location, that aren't private cloud, but really are cloud-delivered services that supplement the delivery of, that supplement the functionality of those private clouds and co-location. And again, we call this hybrid computing, cloud computing, and I think many of you will start to hear the word hybrid computing a lot more in the future. And in general, in the marketplace, what it means is you're going to blend using your own equipment, dedicated equipment that's managed by others, and then publicly available services out in the internet. Go ahead on that. Obviously, some people are, many businesses, in addition to healthcare, have issues with shifting towards the right of that original diagram and adopting hybrid computing, and they have challenges with it. Not just healthcare, but banking, e-commerce, and government all have very similar compliance frameworks to them. Banking has what's called the Gramm-Leach-Bliley. E-commerce has the payment card industry digital security standard. The government has the Federal Information Security and Management Act. And then, of course, it's HIPAA, the Health Information Portability and Accountability Act. And there's a wide variety of other compliance frameworks that are very similar to this, and they all, at different levels and in different manners, are concerned about sensitive data and concerned about the reasonable and appropriate protection of the sensitive data. And when you drill down into all of these different compliance frameworks, you realize that they really are worried about three things. And those three things are confidentiality, availability, integrity. The ability to keep things private, make sure that only the appropriate people see data, make sure that the people that do have the right to see the data can see the data, so the data needs to be available when it's needed, and it needs to be accurate. We need to have integrity. We need to know that it's not going to be corrupted by viruses or things like that. And this is, long been a challenge for healthcare. Healthcare just very recently, all the medical records were just kept on a shelf in a paper file. Whenever the doctor would write something down, it was pretty easy to keep it confidential. All you had to do was lock the file. It was easy to keep it available as long as the place didn't burn down. It was there, and as long as it was pretty easy to keep it accurate too. As long as it didn't get smudged or anything, you could read it. Maybe not be able to read the doctor's handwriting, but it would stay accurate from the point he wrote it or she wrote it. And now that we've gone on to computers, that's created a bigger problem. You have to worry about confidentiality. Copies of it can be made. It can be lost, and access can be given to it accidentally. It's not just simple as locking a cabinet. Availability is a much bigger issue. You have to think about availability. I mean, availability back in the paper days was the same for a doctor working in an operating room as it was for a doctor working in a small office, as it was for a researcher sitting behind a stack of medical records trying to figure out a pattern in healthcare. Well, in computers, those levels of availability can and need to be different. The doctor that's in the operating room absolutely needs access, and the doctor that's in the clinical environment really needs access, but probably could do without it. And the doctor that was in the research environment, well, it's important that person have access, but maybe she should spend some of her money, instead of keeping perfect availability, she should spend it on more research. It's more appropriate for her to have less availability. She doesn't necessarily need it all the time in case there's a computer crash. So all these companies are worried, and all these compliance frameworks, depending on what they're worrying about, banking is really worries about availability and security, obviously. They all worry about different levels of confidentiality, availability, and integrity. And different companies and different providers have different appropriate levels of those things. Go ahead. Despite all these challenges, we're seeing a rapid adoption of HIPAA in the cloud, and healthcare companies use in the cloud. In 2014, HIMSS, which is the Healthcare Information Management Systems Society, the largest society dealing with this in the United States, did a survey, and the survey revealed a number of things. Number one, that 83% of healthcare providers use cloud services and are going to use cloud services. Now, the predominant portion of this 83% on this slide, represented on the slide, are using that second type of cloud computing that I was talking about. They're going out and using a remote delivered software as a service type of cloud computing. Somebody is delivering through the web functionality that used to be accessed through software, that they would used to have to buy and software install themselves. Now, that provider that's providing the software as a service might be running their own in-house operation. They might be in a co-location. They might be in a private cloud. They might be in a public cloud, or they might be in hybrid. Most likely, they're in some type of hybrid computing solution. But most of these are adopting the last 12 or 13% there are obviously the people that are using this other type of cloud computing that we're talking about today. The reason for the adoption of the cloud and use, obviously, is the maintenance costs. It's, when you don't have to deal with, the less infrastructure you have to deal with, the more you can shift to the right of that initial diagram towards cloud computing. The more you get away from the real world, the less you're maintaining. And the idea is that hopefully the provider that's now doing that maintenance is better at it, can do it for lower unit costs, and thereby pass on the savings to you. Speed of deployment, you don't have to worry about how to install stuff or how you're going to install stuff. It's much faster. You don't have to worry about staffing challenges that are presented by spinning up new applications in your own offices. And most of the cloud services that people are adopting are clinical apps, HR apps, and backup and disaster recovery is obviously also a big target for cloud computing. Disaster recovery has long been, we've seen in our industry, something that's important to people, but something that they put off because it's expensive and it's difficult to do. And cloud computing, because of the advent of virtualization, the ability to shift computing infrastructures very easily, and the advent of having providers like us able to offer compliant operation of computing loads, we're starting to see a lot of backup discovery operations that used to not really be effective take fruition in the marketplace. There's some obstacles, though, obviously, that the HIMSS survey has revealed. These are, again, reported by the HIMSS survey. These are not things that we necessarily see, although our experience mirrors this experience that we see from this on the survey. 33% reported slow response to the services. That can be that's a problem with all software as a service vendors. It's a problem that's got, in this 20 years of doing this, I can tell you one of the things that surprises the software industry, or at least used to surprise them, they've learned a lot since then, is that this transition from doing packaged software, where you package software and you deliver it to somebody and they install it and they maintain it and operate it and they back it up and are in charge of it. One of the big difference from that model to the I'm going to deliver a functionality across the web is that the provider now has taken responsibility for the operation of the network that's between the user and the whatever server is running the software. And that network is much bigger. It used to be just going across an office where there was just some wires and maybe a network switch, and now it's going out across an internet connection, across the internet, and this huge, disparate inner network of networks. So there's latency obviously involved, and performance issues can be involved in cloud computing. 23% reported downtime or unavailability. Obviously, those are some providers that are working towards getting better availability. Some of the challenges they report are operations visibility. Whenever you shift something out of your office, it can be more difficult to operate. Customer service, costs and fees, availability and uptime again is an issue. Migration of services or data, contractual issues, which we'll talk about in a second. And then 38% say they have no challenges. I think most challenges that we see are difficult to initially shift out there, and then there's some friction involved with making sure you have good connections and making sure that you have the appropriate availability involved. HIPAA in the cloud considerations. So these are considerations. Obviously, these are also off that survey. These are the top two things that from the perspective of the users, this is why they're hesitant or their concerns about dealing with third-party providers or shifting into the cloud. The first is the provider is willing to enter a business associate agreement. And remember I talked about the conduit exception earlier and the fact that our industry asserted the conduit exception for so long, and a lot of our industry still asserts it. And then once you get involved, it's not just a matter of, oh, yes, we'll sign a business associate agreement. There's not a standard business associate agreement out there. The omnibus rule, when they published it in the Federal Register in January, I believe 25th of last year, has talked about having a sample business associate agreement. And indeed, the Office of Civil Rights of Health and Human Services published a sample BAA on their website. And we at OnRamp, in fact, have used that BAA as a starting template for ours. We've added a lot of other important things to our business associate agreement that we think more accurately reflect our business relationship with our customers. But a lot of people want, so there's not just will you accept a BAA, it's what is going to be in the BAA becomes an issue. And then the second issue is obviously physical and technical security, which is an obvious issue for anybody dealing with HIPAA. Now here's some HIPAA cloud considerations that we think are very important, obviously. And not all these challenges or to be compliant are specifically to cloud computing. These are associated with any type of outsourcing of your computing at all or EPHI at all. The first is, of course, security and compliance. There is associated with storing EPHI in platforms that do not have compliant hosting processes. So obviously, if you're using a hosting provider that doesn't understand HIPAA compliancy or isn't involved in HIPAA compliancy or isn't taking responsibility for HIPAA compliancy, that's a big issue. That means you're going to be responsible for doing everything, and you'll have issues with maybe different things going wrong that you're out of your control and hard to direct, obviously. So security and compliance is the first issue. Media sanitization can be a big problem. Whenever you shift data out onto somebody else's network, it's very difficult to understand how are they going to clean the media or any of the computing infrastructure that has been exposed to that media, that EPHI or that sensitive data after you've stopped using it. Media, of course, is anything that's a hard drive or a USB key or a tape drive or any of these things. And all those things are used in data centers and are used by cloud providers. Just, the cloud doesn't exist out in the ether. I mean, it really exists someplace. It really is somewhere. So even if you're using a service that you think is, kind of out there and magically appears, it physically is on a computer somewhere, and those drives physically exist. And when you adopt cloud services, you have to worry about, what is going to happen to a hard drive that's on a storage area network, a SAN, when it's pulled out by a vendor that's coming in to fix a hard drive, fix the SAN. And when he's going to RMA that hard drive and send it back to the manufacturer, or are they going to properly sanitize it and destroy it? And this is extremely important for HIPAA compliant companies. And this is what we tell our customers is the primary bar that they need to hurdle. And they need to make sure that they, in all instances and throughout their infrastructures, are satisfying what's known as the breach notification rules safe harbor for breach notification. And that safe harbor, in short, says that if you have a piece of physical media, a piece of hard drive, a USB key, or something like that, that is exposed or is given access to somebody that doesn't have the authority or proper access to the right to see it under the privacy rule. HIPAA says the person can't see it and they get access to that media, then you have to notify. You have to notify the customer, the patient, whose data was exposed of that breach, unless you could prove that there was a low probability that got breached at all. So there's obviously sometimes a question of whether a breach occurred, and then if you have anything but a low probability, you have to go tell those patients. And in fact, so what that means is a lot of these breach notifications that you hear about in the news aren't necessarily breach notifications that are, the kind of the target hacking that happened at the Target stores, or we saw J.P. Morgan get hacked a little while ago last week, I guess. But really, they were just a loss of media. Somebody was a good example was going home with a laptop, and the laptop got stolen. They don't know if anybody's actually looked at the data on the hard drive. They probably wiped the hard drive and they're just using it because they couldn't get in, but they have access to the data. Or somebody's lost a backup tape. There used to be 10 backup tapes, and now there are 9. The largest class action lawsuit today in the United States related to HIPAA breach is related to the loss of a media. It was a case of a box of hard drives that was left in the data center, a data center that had been deprecated or shut down, and all the computers had been decommissioned, but the hard drives were left in a box in a storage room, and then the security was temporarily lost in the building from a power outage, and the box of the hard drives disappeared. Somebody stole them. They're probably sitting in somebody's house and being used to store data, and nobody really got on them, but they had to do a breach notification, and now it's a $4 billion lawsuit. So media sanitization is a big deal with HIPAA compliancy and outsourcing. Client collaboration is also a big deal. Client collaboration means that when you're dealing with your own data and you've trained your own personnel, it's easy to make sure that everybody's on the same page. When you're dealing with a third-party provider, it can be very difficult to provide client collaboration. And just to give you a single instance example, here at OnRamp, for all of our customers, we're in charge of making sure of physical security, making sure that only authorized personnel are given access to our customers' information systems, whether it's colocation or managed services. But our customers are in charge of making sure that the list of people that are authorized access is maintained well. So when our customer fires their systems administrator or somebody like that, they need to know the procedure by which they call and notify us or write us and make sure that we expeditiously remove that person's access from the data center so that they can't get in and do something nefarious. So that's a shared client collaboration, and those issues span the entire security rule. Everything about who's going to do encryption, who's going to make sure the hard drives are sanitized properly, who's going to train all the personnel. All these things are issues that need to be done collaboratively. Now, some considerations, other considerations include availability and uptime, and we discussed those a little bit earlier. But availability is a big requirement. Depending on what you're doing, obviously the EPHI needs to be there when the client wants to see it, or when the patient needs to see it, needs to have access to it. And disaster recovery can be an issue in the cloud. If your primary site is in a public cloud or just pushed out into a public cloud, it can be difficult to make sure that there is a secondary site that is appropriately set up for failover. So that can be an issue and a consideration that's taken account. Now, again, I talked a little bit earlier about how virtualization helps affect disaster recovery. So it helps affect high availability. So we can, inside the same data center or inside the rack, where previously we could only put an operating system on one computer, we can side by side put 2 computers together. Or even with our customers, if they have a main infrastructure, we can, in co-location, we can stand up a private cloud next to them, and then with virtualization, affect high availability such that if part of that infrastructure failed, the other infrastructure, even in the same facility, takes over immediately. So availability and uptime is both a concern, consideration as a concern of adopting hybrid computing, and it's a consideration because it facilitates availability and uptime. And then business negotiation can be very difficult in a hybrid environment or in an outsourced environment. Obviously, once you get involved with a third-party provider, there's the business associate agreement, as we mentioned earlier and we discussed earlier, that has some requirements that have to be included in the business associate agreement. The requirements basically say that the business associate, the person that's taking the EPHI, that's going to receive or maintain it or otherwise use it, agrees to take reasonable and appropriate protections for the confidentiality, availability, and integrity of the data, that they're going to agree to follow the security rule and the breach notification rule, that they'll agree to notify the upstream, the customer, the vendor, or not the subcontractor, but the contractor, the covered entity. They'll notify them if a patient directly contacts us and says, hey, I want a copy of my data, I want to change the data, or I want to see who's been having access to my data. The Net Business Associate Agreement covers all that. But when we enter into those agreements, we also invariably enter in discussions of other things that are related, mainly the sharing or sharing of risk, what I call sharing of risk provisions, like indemnification, limitation of liability, and the inevitable resulting issues of who's going to take care of that risk. So who's going to get privacy injury liability insurance and things like that. How are we going to take care of a breach, and who's going to pay for a breach when it occurs? At OnRamp, the way we affect HIPAA in the cloud is to deploy hybrid computing solutions. And this is an example picture of a hybrid computing solution that we would deploy. This would be a healthcare company that started off with co-location and a private cloud, or excuse me, with a firewall, and then they, for some reason, either they had a new clinic or a new project or something, or they maybe needed to scale, or maybe they just needed to make a physical to virtual. They decided they wanted to adopt virtualization and weren't confident of it, or they just wanted to go into managed hosting while not throwing away their legacy investment already that's in their co-location space. For whatever reason, they've adopted in this left triangle, this red triangle over the left, in this protected zone, a private cloud co-location hybrid solution, and then they've supplemented it with some cloud delivered services. The backups obviously are there, enable them to perform backups, and the SAN storage enable them to use common storage between their physical boxes. That's a requirement typically of virtualization, is that you use SAN storage. And there's an important point here about these cloud delivered services. This customer, most likely, or many of our customers, wouldn't be able to perform these things that are in this right triangle had it not been for hybrid computing. Backups, the type of backups, infrastructure that we use to effectively back up our customers co-located in private cloud, and the types of SANs that we use to provide effective IOPS to our co-located and private cloud customers are really out of the range of our typical customers' ability to purchase. They're very big, very expensive, and very difficult to run. They're very expensive to have the proper training and proper employees trained to run those SANs and those backup systems. And what we're able to do with cloud delivered services is to acquire those expensive systems and maintain them, and then to share the functionality of those systems with our cloud customers. So it's another benefit of hybrid computing is that people that were previously limited to what their co-location space could do or what their private cloud environment can do now can use these higher technologies that were previously only enterprises could operate. Here at OnRamp, when we have a HIPAA customer come on, we've developed what's called a 3-step HIPAA risk management process. And we're not doing a risk assessment of our customer. That's the type of risk assessment that's required by HIPAA. What we're doing in our risk management process is making that we handle that, what I talked about earlier, that compliant collaboration, to make sure that we're really working hard to make sure that both our customer and us are doing the appropriate things collectively to protect our customers' EPHI. The 3-step process is real. In short, the first step is we collect data. In the collecting data phase, we ask a bunch of framing the risk questions so that we understand, what we're dealing with. Is this the primary site? Is this the secondary site? What is this EPHI going to be used for? What are the dependencies on it? How's the data going to be transmitted into the facility? How's it going to be transmitted out of the facility? What are the special considerations? Then we build what's called a system characterization, which is a physical picture of all the devices in the infrastructure. And then we enumerate through each of those devices, and we ask a series of questions about this. So when we hit a server, we want to know how data is going to get on and off the server, how we're going to do encryption at rest, and those types of issues. Then once we're done with the first step, we move on to the second step where we assess risk, and we use all the experience we've gained from dealing with hundreds of customers that deal in all these different industries that deal with confidentiality, availability, and integrity. And we help point out vulnerabilities, and we answer questions for our customers and make sure that we're all on the same page regarding risk. When we move into the third phase, we produce a BAA, a business associate agreement for our customers, and then we produce three documents, three levels of instructions to our customers that talk about how they should move forward in a compliant fashion. The first one is a real simple kind of quick start list of how you could do HIPAA compliancy at OnRamp. The second one is a full-blown, what we call responsibility matrix, that lists line by line every security role and implementation specification of HIPAA and talks about what OnRamp does and what our customer does to provide HIPAA compliancy. And then the third one is a spreadsheet, actually, of NIST 853 controls for those of you that are involved in much deeper IT security. They're full-blown NIST 853 controls that we've taken and specialized and customized, and then we split them in half, really, in two, so that our customers have a set of controls and we have a set of controls that completely describe in very great detail what we do and what our customers do. And we think that list of NIST 853 controls, if a company, a startup HIPAA company, got those controls and started from the top and started writing down to the bottom and wrote their security policy, they would accurately describe how they could compliantly host HIPAA at our data center, in our data center. Now, HIPAA in the Cloud 4 class, according to the HIM survey again, is partly sunny. Nearly all adopters will expand cloud services. We're going to see the hosting of archive data, again, backup and disaster recovery, and the hosting of operational apps will be the areas of expansion.
Great, thank you, Chad. We're going to open it up to a Q&A right now. Chad would be happy to answer all of your questions submitted via the questions window, and we're going to answer all that we can in the remaining time. If you do have to jump off, this webinar is recorded, so you can access the recording following the webinar. You'll be emailed the link. So the first question we had was regarding mobile platforms. Can you speak a little bit more about HIPAA in the cloud in terms of like phones and tablets?
Sure. So obviously mobile platforms and in general, BYOB is an issue with HIPAA compliance. First, without answering the question, just the devices themselves are opening up in general with IT a security issue in that everybody is bringing their devices into secure environments. So in regards to just having your employees using devices, or what's called BYOD, bringing their own devices, bring your own device to work, and then using it in what was previously a secure and very tightly controlled environment, is turning out to be a big issue for security. We are finding that people that remotely connect in with VPNs into protected zones, themselves, their laptops become compromised or their tablets become compromised, and then those tablets and laptops are used as a platform to gain entrance into the protected zone through the VPN, the authorized VPN that's access to. But mobile devices on the receiving end, the software device, present other issues also. And we see a lot of we've been to the American Telemedicine Association convention in the past couple of years, and you see a rapid and broad adoption of using iPhones and Android phones and just remote wireless devices in general to transmit data. The first obvious, there's a couple of screaming issues. Obviously, the transmission of data is very important. Any transmission of data across an unsecured network should be done with FIPS 140-2 compliant encryption enabled. So that's a whole other webinar to talk about how to do that. But in short, the encryption can't be just good encryption. It's got to be FIPS 140-2 compliant, and it needs to be from end to end. It needs to be all the way from the device, the iPhone or whatever, all the way down to the server that accepts the data, or within the protected zone from some other device within the protected zone that's protecting the data. And the other issue is obviously media sanitization. What happens to the device if somebody's looking at EPHI, if they're looking at the device and a copy of it gets made on that device and then the device gets lost or just disposed of? How do you sanitize that media? I know this can come in unexpected ways too. I know that at least in the past versions of phones, when you tilt the phone to the side, it kind of flips and shows you it goes from portrait to landscape mode. It used to be, and I'm not sure this is the truth anymore, but it used to be that the way it would do that is it would temporarily take a snapshot, a picture of it, a JPEG, and while it was rotating, you'd be seeing that JPEG picture, and that JPEG ends up being cached. in the background. So if you're looking at an email or even a secure app that has EPHI and you flip it and that phone tilted, well, you may have accidentally made a copy of the EPHI that's on there. So that's a big issue, obviously, is the transmission of the data in between the device and wherever it's going, and the sanitization of the media itself, the device itself, once the computing operation is ceased.
That was really interesting. Thanks. Next question, we wanted to know what are the considerations when hosting secondary data?
Well, with secondary data, obviously the first consideration is it's not primary data. So you have an immediate availability. What we often tell our customers is there's an opportunity here now. There's an opportunity to save money, because most of HIPAA is about can I spend more? Do I need to spend more money to be available? Do I need to go that next step? But if you're dealing with secondary data, if you are the backup, then obviously you have more flexibility and more options to handle that secondary data. We often see people that are in co-located environments, say they have their own equipment, or even if they're in a private cloud and they're in our Austin data centers. We operate data centers here in Austin and in Raleigh, North Carolina. We'll get a private cloud from us in our Raleigh, North Carolina, or if they're operating in a Raleigh, North Carolina, we do the opposite and get with private cloud in the Austin data center. And the point of that is that they'll be replicating copies of their VMDKs or their copies of their virtual machines, their operating systems and their data over to that private cloud, that secondary site, and have those copies ready to go in case the primary site dies. But in the interim, while they're during normal operation, they'll take that secondary site because they don't need it immediately available maybe. They'll use that secondary site for test or development, or maybe for some other type of primary IT operation that's not critical. So maybe it's their billing system or their timekeeping system or something like that, some system that they can shut down in an emergency. So secondary site consideration, the first consideration obviously is wow, how much availability do I really need in this backup site of data? And then of course the other consideration again that exists always is how am I encrypting it when it comes from the primary site to the secondary site.
Great. So someone wants to know if there is a such thing as a HIPAA compliant server.
Well, yeah, you can make a server HIPAA compliant. You can be HIPAA compliant while you operate a server, but you can't. There's nobody that can prepackage a server and sell you the HIPAA compliant server. HIPAA compliance is not a thing that comes in a package, and it's not something that we can give to you. It's something that we need to collaboratively work with our customers to do. You know, HIPAA was related, the security rule was related as if, you know, the customer had a copy of the data and then they were going to do business with the business associate, and they made a copy of it and they gave them the copy of the data, and now the business associate has to do everything to protect the CAI, confidentiality, availability, integrity of that data. And that's not what's happening in our relationship or in this hybrid cloud computing relationship. What's happening is we're not making a copy of the data. We both are collectively protecting the data. So our customer and us at the same time, through time, are protecting that data. So it's that constant collaboration that needs to exist. It's the ability to make sure that we're constantly assessing risk and addressing new vulnerabilities and new risks and new challenges, and make sure that we're worried about availability and making sure that the system's maintained well and accurate. Accuracy is an ongoing effort. We have to make sure that there's no viruses and things on that server. So HIPAA compliance is not something that just happens. It's something it's an ongoing effort. I'm not sure you can be stamped or certified. I know there's no certification for HIPAA compliance, but it's an ongoing effort that needs to be made. So I wouldn't say you can have a HIPAA compliant server, but you can sure be HIPAA compliant while using servers for sure.
Okay. So how hard is it for you to provide safe harbor?
So it's not again, this under the breach notification rule. There's a safe harbor. There's a number of safe harbors that I don't talk about. One of them is basically safe harbor is, oh, you had a breach. Somebody that wasn't supposed to see the data saw the data. Do you have to tell the patient? One of the safe harbors is, oh no, the person that saw the data was just another nurse in the same place, and she didn't mean to see it, and she quickly closed it, and she didn't do anything with it. So that's one safe harbor. We're not going to talk about that or the other ones that are like that. The one that we're really involved with is the one that says that if your media is exposed to somebody, you have to, under the breach notification rule, you have to do what's a risk analysis and you have to ask yourself 4 questions, and I'm sorry, I'm not going to be able to yank them off the top of my head, but they're basically, who do you think had access to the data? How much do you think they had access to the data? What have you done to remediate their access to the data? And after asking these 4 questions, you end up with, you have to make a judgment on whether there's more than a low probability that the data was exposed. There used to be a standard called the reasonable harm standard, where you actually had to make a decision of, well, what kind of data was it? Was it AIDS data or just their hearing test data? That's no longer the case. It's just a probability that it was exposed. And if you've had more than a low probability that it's been exposed, you have to make a breach notification unless you can prove you have the safe harbor. The safe harbor is you can prove that the media was rendered undecipherable, unreadable, and unrecoverable. And the Health and Human Services, HIPAA, says that they get to set the standards for what that means. What makes something indecipherable, unreadable, and unrecoverable. And they're in their guidance, they've said that is encryption or destruction, appropriate destruction. So you either have to have destroyed the media before they got it, or the data has to be encrypted. And the encryption level under HIPAA is, again, FIPS 140-2 encryption. And for people that are interested in finding out how to do that, I would tell you to Google NIST Cryptographic Module Verification Program, CMVP. And there's a really good information on how to get FIPS compliant encryption. We can also help you at OnRamp, of course.
Great. So actually, that's a great segue into the next question: is how does someone get started?
So obviously, we have you contact us. We talk to people for free, of course, about their HIPAA compliancy. We'd like to talk to you about your HIPAA compliancy and how you can adopt hybrid computing. Or if you just have questions generally about HIPAA, we're very interested. I'll be talking about data security, I guess, here on Monday at Data Center World. So if any of you will be out there, I'll be there and available to discuss that. But contact us here at OnRamp. We've got a number of white papers and information on our website also that talk about HIPAA compliancy and about how we do our 3-step process. I think a real effective way, and the way I encourage people to do, is if they're really trying to create an infrastructure and they haven't done it before, or they're wondering if their infrastructure is compliant, is to go ahead and go through our 3-step process where we frame the risk, draw a system characterization, kind of enumerate through it, point out where we think the risk is, and then really come up with a solution that is appropriate for the customer's use.
Great. So we did have another question just come in. This person asked, based on what you just said, I take it masking patient data going through co-location centers needs hard encryption?
So the masking coding, so I'm not sure what masking means, but I'll try to interpret that. So there's a concept under HIPAA called the de-identification of data. So that means you take data. So data to be protected health information, the data itself has to represent the past, present, or future mental or physical state of a person. The data has to have been collected by what's called a covered entity. So if I ask you the color of your eyes, it's no big deal. But if your doctor does, it becomes data all of a sudden. And it has to the data has to be identifiable to a specific person. So oftentimes what people will do, especially people who are doing research, will de-identify the data. So they'll strip off all the identifying markers, all the names and the zip codes, all that could possibly be used to identify whose AIDS test or whatever it is that we're looking at in the data it is. Now there's a new concern, obviously, because with modern analytics and big data, there's a concern about the re-identification of de-identified data. Now that's a mouthful, but the worry that data that has been de-identified or masked, maybe the identifying data has been encrypted itself, is masked. There might be re-identified by some special analytics applied to the remaining data that I'm seeing. So that's an issue. I would say that you transmit data. Anybody that has access to the data, even if it's been encrypted through a data center, is a business associate. And the real problem with HIPAA, or the real concern under HIPAA, is even when you have a business associate or have a subcontractor, you're not shifting the responsibility or liability for the patient data to them, irrespective of what you put in your contract with them. Under HIPAA, you are directly liable for the actions or inactions of your subcontractors, irrespective of what you put in your contracts. So if you have a business associate and they have a business associate and they have a business associate, if you have a chain of 3 subcontractors under you and somebody makes a mistake, it's your fault. So we recommend you always get business associates with anybody, even if you're encrypting data in a data center, they're a business associate. You need to, because of their persistent access to the data, we would say that you need to be encrypting it.
Great. So unfortunately, we are running out of time for questions, so we are going to conclude today's presentation, but as Chad mentioned, please feel free to reach out to us if you do have more questions. If you would like more information about our HIPAA-compliant hosting solutions, please visit us online. We're at onr.com/HIPAA. And on behalf of OnRamp, we'd like to thank everyone for attending today's webinar, and we hope to see you again soon.